A health program targeted at reducing death of newborn babies in the Ashanti region has achieved a significant reduction in neonatal mortality cases. Through the successful implementation of the program, authorities say death associated with newborns reduced from a record 70 deaths per 100,000 live births in 2018 to 40 per 100,000 live births in 2022. Ashanti Regional Health Director Dr. Emmanuel Kojo Tinkran says the support of the Canadian government and partners, neonatal resuscitation services are being offered in some selected public health facilities. Ohiming has more.
Health authorities observed high incidence of newborn deaths were detected 4 years ago as ill-equipped peripheral facilities referred neonatal emergencies to the Oli Referral Center, Konfanochi Teaching Hospital for management. CATS, overwhelmed by the numbers, could not offer the best of care to the babies, resulting in deaths. As part of the program dubbed Saving the Lives of Children project, neonatal intensive care units were set up at Suntreso, Menchia, Mampong and the Ejuso government hospitals to provide quality emergency care to release the burden on Konfanochi Teaching Hospital. Regional Health Director Dr. Emmanuel Kojo Tinkran revealed the Canadian government and partners like UNICEF provided the facilities with the needed equipment to function effectively.
4 years ago, our neonatal mortality was very high. So what we realized is that most of the cases cannot be managed at the peripheral level. So referrals will have to go to Konfanochi. So we set up neonatal intensive care units and then other hospitals, so that most of the referrals that were previously going to Konfanochi were reduced. And then we posted pediatricians from Konfanochi to these facilities. So instead of referring most of these neonatal cases to Konfanochi, and as I said, the issue was the time, because they were not giving adequate care because the work overload is just too much. And with that, we started seeing reduction in the mortalities. So initially like 70 per 100,000 live births. Now we are working close to about 40 per 100,000 live births, which is quite good.
Canada commits at least $50 million Canadian dollars in bilateral support through its programs in Ghana every year. Canadian High Commissioner to Ghana, Kati Saba, joined the Regional Director of Health on a tour of some of the health facilities in the region.
As the spread of COVID-19 burdened the health systems of the country, the result was increasingly limited capacity to deliver the routine health care services provided by maternal, newborn, and child health clinics. As we know, babies do not stop being born in a pandemic. The overstretched health system, coupled with decreased visits to health clinics, meant that mothers, babies, and children did not have access to critical and timely care. I'm pleased to confirm that a further 15 health facilities have been equipped with medical oxygen infrastructure, and 150 health workers have been trained to administer oxygen to patients in critical care.
Several health facilities are currently benefiting from an $8 million funding support for life-saving health, nutrition and sanitation services for children and women in response to the COVID-19 pandemic. The Ejuso Government Hospital is one of the beneficiaries. The hospital is also benefiting from a reliable water supply system. Nathaniel Adams Jr. is CEO, Rural Water and Development Program Ghana, implementing partners of UNICEF.
This project basically is adding on 20,000 litre storage, 110 liters per minute water supply, a two-seater, and replacing Veronica buckets with sinks to aid hand washing. So for Ejuso, this is what is happening. This is what is being replicated in the 16 additional hospitals and the 22 CHIPS compound.
From Kumasi, for Joy News, Ohiming reporting.